Welcome to another edition of Let's Talk About It. This is Susan Johnson, and we got a great show for you today. And I'm here with my co-host, Dennis O'Brien.
And I'm back on the show after 1 week off. I was carrying it for a while, but now Susan has allowed me to come back in today to talk to John Carbone, and I'm looking forward to it.
Yes, we are. Well, last week we had the mayor and the lieutenant governor on the show. This week we have a great guest, John Carbone, who is the director of small business and broker support and product development at Access Health Connecticut for small businesses. And we're so thrilled to have you on the air, John. Thank you so much for all the work you've done for small businesses, and thank you for coming on Let's Talk About It with us.
Thank you. We appreciate for having me, Susan and Dennis. Thank you.
All right. Well, tell us, first off, tell us a little bit about the work that you've been doing with Access Health Connecticut, and how did you get involved with Access Health Connecticut small business?
Well, my entire background has always been in healthcare right out of college. So I've worked with the carrier side, actually. I've been a producer, and now I've been working at Access Health, going on 10 years in July and a couple of years of consultant, so a total of 12 years, pretty much from the inception. And it kind of just pulled at my heartstrings because I felt like it was something that was required and needed here in Connecticut. We have a huge population of small businesses, and 48% of all employees are small businesses. And that's a huge population, and these individuals and employers need help trying to figure out what's the right option out there for them. So what the exchange does that's a little bit different, as many of you know, the exchange is part of the ACA, part of what individuals used and labeled as Obamacare.
Yeah, or the Affordable Care Act.
Or the Affordable Care Act, which is a phrase I like to use, but people look at me and go, what?
I never heard of that.
What's that?
And then you go Obamacare, and you go, oh, we know what that is.
Correct.
But maybe they don't. Maybe they don't. So.
Not anymore. Correct. It's been a while now. But one time it was just Obamacare.
Correct. We just had our 10-year anniversary, so we're excited to be around for another 10 years and see how we can help Connecticut residents with that.
We were one of the first states to do the Medicaid expansion or Affordable Care Act, and I'm very proud of the fact that we were right there doing that work and expanding access to health care with the Affordable Care Act. So tell us a little bit about how you work with the small businesses and give us that information. And first off, how do they contact you? And we'll do that a couple of times while you're on the air with us. But how do they contact, if you're a small business or you're working for a small business and you might be able to tell your boss, hey, maybe we can get health care through the Affordable Care Act, through health care access, how do they contact you?
Well, they can call us. They can get through us three different ways. One, they can call our basic line, which is 860-241-8445. They are also welcome to email us at shop, S-H-O-P, period, A-H-C-T, @ct.gov, G-O-V, or they can talk to their local producer or broker.
Okay, so if you are a local broker or a producer, then you would have automatically information about how to work with Access Health CT.
Correct. That's cool. Our team goes out to each individual producer. We try to train them on all the products and give them all the different tools that they need. We always kind of say we may not be the right tool, but we will point you in the right direction, or your producer will point you in the right direction. If we are the best tool for you, we're going to make it work and help you out and try to figure out the best way to save you money, but put you in the right product.
Excellent. So tell us a little bit about the product.
No problem. So currently right now we have up to about 10 plans that are currently on the exchange for small businesses. We have about 27 on the individual side. The thing that we do a little bit different that people kind of have a misunderstanding about, so I hope we can clear it up a little bit today or continue to educate, is that we don't work for the carriers. Our job is to help individuals, employers, and employees find the best plan for their needs. So it either can be one of our two carrier partners, which is Connecticut and Anthem, or we try to find something that's going to best fit their needs off the exchange if this product doesn't work. As many of you know, our mission statement is all about lowering the uninsured rate. So we have an arrayment of plans from bronze plans all the way to gold plan. And I know some of the terminology out there for the bronze plans are high deductible plans, and people feel like they're not useful or the deductibles are too high. People need to understand, and I hope you allow me to take the opportunity here to explain to people, those bronze plans have a great, platform, and they're incredible for you to be able to go, get your annual physical, go get your mammograms, go get your colonoscopy. All that stuff is covered before the deductible, so there's no charge to you. So these are the opportunities that the ACA has that allows people to go have these annual physicals and hopefully, get a clear bill of health or make sure that they catch something super, super early. So the one thing that we do different is that, as you can see, we look at the many different options for a small business owner. We'll quote them out in the small business venue, but if we understand that the employees make a different type of pay scale, we'll help that employer move those employees over to the individual side, and that helps with the contribution, because if they're eligible for an advanced premium tax credit, that's going to help that employer keep money in their pocket, and they can use that money to either hire new employees, keep putting it into the business.
Well, this is something I want to emphasize. If you don't mind, I would love to emphasize the fact that if the employee in these Affordable Care Act Access Health CT business plans say they can't afford the deductible, the high deductible, but they can, because of whatever their income is, they can be moved from that as an employee over into the Affordable Care Act plan that subsidizes them up to, 400% of poverty?
Yeah, absolutely. There are a few other little things in there that we'll work through them, making sure that, if the employer cannot afford to contribute a lot of money, that can be another reason to put them on the individual side. We try to do what's best for those individuals and that employer throughout this whole thing. So that's something we do different that's in the system currently right now, because we're kind of stuck in this rut of, small business, we got to quote small business products. As healthcare is kind of evolving, we need to be evolving with it. And this is our avenue. We've written over, just from the beginning of January into now, we've written over 4,300 individual employees onto the individual market because it was the right thing for us to do with them.
That's excellent. So you really do help people get access to health care, just like the title of your program says, access to health care for people in Connecticut. And being able to make that transfer is unlike other plans that are not in the access to health care, they don't participate in access to health care. So it's different because
Correct.
of that. Am I right?
Yeah, so if right now, like I said, if it's just on if they have Anthem and Connecticut, those are the two products that are on the individual platform, and currently right now on the Exchange Small Business platform. But if we don't have producers or brokers looking to see if this could be a fit to where they can move those individuals to the platform, those are the two that are licensed on the individual market to be able to, get those advanced premium tax credits if they are eligible for them.
Mm-hmm. And tell us about what a tax credit means. It says, what is the Small Business Health Care Tax Credit? What is that anyway? Tell us about how that works.
Well, small businesses here in Connecticut have the opportunity on Exchange, if they have 25 employees or less, those 25 full-time equivalent employees or less, and the employer contributes 50% of the contribution of the single premium, the employer can be eligible up to a 50% tax credit. Non-for-profits are 35%. Well, people say, well, why so cheap? Why is a non-for-profits 35%? And the easy way to explain it, usually non-for-profits pay about 100% towards the individual deductible, or individual employee-only premium. So as you can see, that could substantially be a lot more money. So what that means is usually the average for a small business for-profit is probably around, I think it was around $2,700, $2,800 in the tax credit, and it's almost double for non-for-profits.
Okay, let me ask you a question about that.
Sure.
If nonprofits are not paying federal taxes, where is the small business health care tax credit from? Is it from the state?
It's from the federal. federal government.
So
It basically comes right back into them as a check. They can deduct it off of the payroll taxes, they can deduct it off of whatever they're paying on all that, or they, at the end of the day, they can take a clear check right into operating budget.
All right, that is wonderful. This is information I didn't know, so this is amazing.
Oh, wow, something Susan didn't know about healthcare. That's incredible. You know, I get my advice on healthcare from Susan, and I'm not an expert on any of this stuff. I have some expertise, but not in this area of the law. I used to know a little bit about it, but when I was a legal aid lawyer, John, for 23 years. But
Wow.
Susan is quite a bit of expertise on it. And one of the things that impresses me about your agency in general is the fact that the average person doesn't know an awful lot about these healthcare programs, and they can find out about them, and you can steer them in the right direction. And I think that's a real valuable resource in and of itself.
Thank you, we appreciate that. We'll spend as much time as we need with someone. There is no cost to them. We're here to basically advise them, point them in the right direction, work with their brokers, validate what their brokers have. Our job is just to help whatsoever. I always say we do have skin in the game, but we're not compensated by any of the carriers, so any decisions that we're making as licensed producers for it is just in the best interest of those employers and employees. That's our main goal too. And also, people can go to our website at Access Health CT Small Biz with the Z.com, and a lot of this information's there. We keep our website very simple. You can quote plans, you can look at our plans, you can pull any PDFs down, but if you have any questions or anything like that, don't hesitate to reach out to us at the 860-241-8445 number or the email address I stated before.
Now, usually when we talk about healthcare and healthcare programs on this show, I play the role of everyman, and that is the person who doesn't, have any expertise, and I ask questions that I think maybe, the person on the street would ask, because that's me anyway. I have coverage. I'm a retired state employee, so I have coverage through that, and I'm very lucky to have it. I'm still working as a lawyer with Susan, but I no longer work for the state. But anyway, I have great coverage, and I think I wish everybody could have that too, but that's not the case, and so that's another reason why your agency and what you all do with the state of Connecticut is so important. One question I would have is, you're both talking about small business, and I think you gave us a clue at first when you said 25 employees or less. Is that what defines a small business?
No, that's only to make you eligible for the small business tax credit. So for small businesses, and according to the Department of Insurance, for health insurance quoting reasons, it's 50 full-time equivalents or less. If you have any questions about that, or you think, I have a whole bunch of part-timers, or I have a whole bunch of seasonal individuals, and it seems like I have, 75 employees, but most of them are part-time, give us a buzz. We'll help you out with that. The rule is usually 2 to 1. For every 2, part-timers, it equals 1 full-timer.
Right.
So, but we are more than happy to sit there and work with you and figure that out for you, so you don't have to sit there guessing.
That's wonderful. This kind of information is so valuable for people to know, because there's so many people that I'm sure are affected by this and who could take advantage of your services, and probably already a lot of people do, but I'm sure there's more people out there who need to know more about it, and by listening to the show, they may be able to be calling you or your office and getting some advice.
We appreciate that. We're here to help, and we're gonna continue to help as many small businesses and employers and employees that we can.
Excellent. So you have on your website, you have something, a little section called More Good News, and it says you can carry the credits backward or forward to other tax years. Your tax return can be amended if you forgot to claim a tax credit, and the premiums paid on employees' behalf can count toward both credit and deduction. Could you explain those 3 items?
Well, what ends up happening is that you have someone who basically has a different effective date. They have a different time of the year. Everybody thinks that most of all contracts in small groups start in January, end in December. Not true. Mostly in the employer world, they run 12 months throughout the year. So what they're called policy years. So you can have someone who comes from a off-exchange plan, carrier, comes onto the exchange, and they may be eligible for that tax credit. Well, you know, at the IRS, they do everything in a calendar year. So when they go to file those, they can say, hey, I've had this plan now for 6 months. The previous year, I'd like to get credit for that. Can I get credit for it? And usually that's what I always kind of say, work with your CPA, your accountant. He or she should be able to help you through that process. That allows them to have that flexibility, and they can amend a tax if they didn't know they could or they didn't know they were eligible for it. And we will work with them to make sure to help them and point them in the right direction.
Excellent. So they can go back to you once they have a policy and say, hey, looks like I could maybe have a little bit more in terms of my tax credits, and you'll help them figure out whether or not that is something they can do. Now, do you do that through the broker, or do you do that as part of Access Health Connecticut?
So we do it both ways. We always want to notify the broker during the renewal process at the end of the year. Hey, remind your client, here's the information. Remind them that they may have been eligible for a tax credit the previous year. They've been on this policy for 12 months. If they do fit that, then that's fantastic. Give it to the CPA, give it to the accountant, ask him or her to basically take a peek at it. And if you do need to do a quick amendment, do a quick amendment because you don't want to leave money on the table. So every renewal that we send out, we like to continue to talk to our brokers about it and notify them and make them aware of it.
Excellent. Have you done a cost-benefit analysis based on ACA versus other plans?
So we haven't done that yet. There are other things out there. Well, we have done them. Basically, we can send you those information. I don't have those numbers at my fingertips, but we can get you that information, or we can have another conversation about it. I think there are benefits to individuals being on the exchange, employers being on the exchange, and looking at both sides of the fence, as what I say, is kind of, is the individual a better product for you because the employer gets to keep more money in their pocket because their employees are eligible for advanced premium tax credits? Then that's the direction to go. You know, we make the employers aware that, hey, if you're contributing, you need to remember you're eligible to do this pre-tax dollars, and so are your employees. Make sure you tell your CPA and accountant to do that so you can get that 20 to 28% difference. The number does vary, and I always say I'm not a licensed CPA or accountant. Always check with your CPA and accountant or your payroll company. They'll be able to help you get all the necessary paperwork in place to do that. But we try to give everybody those different avenues and make them aware of it. So we do have some statistics out there, but it's really different on different varieties.
It does sound like there is more opportunity with these different plans because anybody in these plans can, if they have very low wage workers, can get into the individual plans up to 400% of poverty, in which case those are subsidized by the Medicaid program, and they can just go from there. And I'm not sure exactly what the top dollar is for people in those plans, but for a family of four, before some of the changes in the rules, it was they were eligible for the subsidy at $90,000 a year.
I think you are correct on that. I was hoping to have that right at my fingertips,
That's
but
okay.
unfortunately I don't.
I think that it changed just recently because of the IRA changes and the 7% maximum.
Correct, for the American Rescue Plan. Yep.
Correct. And now I'm not saying the full thing. Anyway, we have one more minute left. Tell us again how we can reach you and a few things that I might have missed in terms of asking you some questions.
Now, first you can go to our website at accesshealthctsmallbiz.com. You're welcome to email us at shop@ct.ct.gov. You're welcome to call us at 860-241-8445. And if you kind of sit there and kind of go, well, how do I get this started? How do I do this? I don't know how to do this. We've never done this. We have 2 employees. What's the best route for us? is this gonna cost us money? This is absolutely no cost to you. We're here as a resource for you. We have individuals on the team that have 20-plus years of experience. Our job is to help you understand all your best options. The job is help you create the budget necessary for you to have what you need to do and retain your employees, because this is a big piece in retaining employees, especially in this environment currently right now. We're here to help, and we'll basically point you in the right direction. And people are always amazed when we basically tell them, this may not be the bucket for you because we think this, and this. And you may be, if you have Fairfield County individuals who travel into the city, we may give you alternative options because we think that's the best fit for you. And as I said in the beginning of this conversation, it's all about our mission statement: help lowering the uninsured rate, keeping people insured by having them understand through education, healthcare literacy, what their plans are about. And I'm going to reiterate this too: just because you have a bronze plan, please read your benefit summaries. You have access to great care before your deductible. Primary care, physicals, OBGYN, colonoscopies, mammograms, all that stuff. So don't be scared about that. If you have any questions, call us, 860-241-8445. We're here to help.
Wow, John Carbone, you are great. Thank you so much for being on Let's Talk About It. And thank you so much, everybody, for listening. This has been John Carbone. He's the Director of Small Business, Broker, and Support Product Development at Access Health CT for small businesses. He can help your small business and make sure your employees are covered with insurance, and he can find the best deal for you, and it won't cost you anything to find out. So it's free. Thank you, John Carbone, and I hope to have you back, and we can talk some more about this, because this is all really important stuff for people, and I know people listening will really, really appreciate your work. So thank you so much for everything you do for the people of Connecticut and their health care.
Thank you for having me.
Thank you, John. Hey, it's Dennis O'Brien back again on Let's Talk About It. I'm so happy to be here with my co-host, State Representative Susan Johnson. We're going to spend the time remaining on the show to talk a little bit about the last legislative session. We can't cover it in the time we have left, but we're going to do our best. Right, Sue?
That's right, Dennis. I mean, we have a lot to talk about when it comes to the legislative session, and a lot of this has been coming out in the press. But, it's good to know that that we've been able to focus on Windham during the session, and communities like Windham. And that's been one of the objectives of mine and of Senator Flexer, and people who also have communities that are similar to ours. We finally have a good voice, and we're exercising our voice. And the first place I'd like to go is to talk a little bit about our education cost sharing grant and how it's finally been equalized. Since 2017, we passed a law that said we were going to make sure that we were going to take care of that education cost sharing grant so that our funding would be similar to the funding of the towns around us based on the income and the resources we have here. And so that's what we've been doing by that formula, the standard formula for everybody. And we finally have standardized this, and by 2025, we've equalized our education cost sharing grant.
That's really important, Susan, and that's a kind of a goal that we've all been moving towards in a lot of different ways through litigation and whatnot, and it ends up being a legislative matter. The judges want the legislature to make those decisions under general guidelines, and it's just amazing what has happened in the last 7 years or so at the Capitol with regards to the ECS, the Educational Cost Sharing Grant. And, much more is coming into places like Windham, Willimantic, New Britain, Hartford, New Haven, Waterbury, Bridgeport, and so on. And that is very, very important. It's very important for the school children there especially, and also for the people who work there as teachers, staff, and all kinds of jobs that they have. Helping kids get educated, that is one of the most important things that government does.
Yes.
And at local government, it is probably the most important. And we're doing a lot better here in Windham now, and a lot of it is because of assistance we're getting from the state.
Right. And, it wouldn't have, some of it is attributable to some of the works that you did when you were participating in the litigation called the Connecticut Justice for Education Funding. And once all that discovery came out from the litigation, we were able to point to hard facts about how so many of the towns in Connecticut were being underfunded. Our town was being underfunded to the tune of $10 million a year. And many other towns were hundreds of millions because they had larger populations. Nevertheless, when you underfund a particular place like that and they have no room to raise taxes because they have no taxable property, this is something that makes a very, very big difference for the students in those areas. Just to give you an example, Dennis, this next coming budget cycle, Wyndham is standing to gain $4.7 million for the education budget. That is money that will go straight to the public school system, and that is money that will be delivered so that we will be able to make the classroom sizes smaller, make sure that our teachers are paid more equitably, because we have the lowest paid teachers in the whole state, and make sure that we have access to more resources for students who have a home language that isn't English. Now, this time we have been able to include the percentage of students who have a home language that isn't English in the formula. So when a town has a lot of students that have more than one language, they're able to provide the resources for the teachers to be able to communicate with them and have the proper communication, because let's face it, if people don't understand what you're talking about, they're not going to learn a lot. So it just goes to reason. Anyway, so that is what we do. And you have to keep in mind too, it's not like people are coming in and out of this country, coming in and out of the country with different languages. And so it's important for us, because we're international now, we have an international economy, for us to be able to have that flexibility in order to be able to grow the economy here in Connecticut.
Yeah, I'm really proud that I was able to work on the CJEF case, the last big case that was undertaken in Connecticut with regards to the funding of schools through the Educational Cost Sharing Grant, and that case was won at trial, and unfortunately it was reversed by the state Supreme Court on the grounds that were not expected by those of us who were involved in it. I was lucky enough to be appointed by the council to be Wyndham's representative on that board of directors that helped run the litigation with the volunteer lawyers from New York that actually did the case. But Judge Mukausher, who used to be in the state legislature, did a marvelous job in that case. He wrote an opinion it was about 100 pages long, and he pointed out all the shortcomings in our state educational funding system. And even though his decision was reversed, several really, really progressive people and very, very smart people in the legislature, I can name lots of them, but I'm going to name one of them, Susan Johnson, saw that these things needed to be fixed on the legislative level. And it all started 7 or 8 years ago. I could name a lot of legislators from downstate who worked on that, but we don't have a lot of time here, and it was a group effort by a lot of people, and it's just amazing, because the goals that we sought in the CBAC litigation that we did not get, because Judge Mukausher's decision was reversed by the state Supreme Court, were obtained anyway by our wonderful legislative delegation.
Well, thank you for that, Dennis. I really appreciate it. You know, nothing gets done in the legislature or the local level without a group. And we did have a very wonderful group. And we've been looking for the correct funding for years, but we have been very, very lucky to have the group of people that we have in the legislature working to make sure all the students have the same opportunities all throughout the state. And that's so important for everybody to really take it. And we have more work to do, Dennis. But this year, I'm very proud that we got this done. And we'll be working on, we now have also developed a special education task force. And we're going to be looking at each town and how they deliver special education to children that have special needs. They have learning differences. Doesn't mean that children in special education cannot learn. It just means that how they learn is different. And there's all different reasons for that. And so to be able to make sure they have the same advantages, because we know that now so many of us have learned so much about different learning styles, that we're making sure those students will be able to also benefit and work just as effectively as any other student who is a traditional learner. So we're going to be focusing on that next time, and I'm part of that task force where we're going to be working, and I'm going to be going to those meetings, and I'm trying to get people to come to the meetings who have these expertise in the area, and they can give feedback. So that's another thing that we were able to do this session, and I'm looking forward to seeing some of the changes that we're going to be able to make. One of the things I hope to do is to put special education reimbursement on the same kind of funding schedule as we have with our education cost sharing system, and that way the communities that can afford to pay will pay, and the communities that have no taxable property where they are they will be able to take advantage of a little bit better reimbursement rate for special education. So we'll be looking at all of those things. And then the next thing that we did, as kind of in line with special education, is we're working on, we had another wonderful year to address the behavioral health needs of our younger population, and also we'll be looking into the behavioral health needs of our older population as well. So we'll be looking at that, and we have a task force that's been set up, and I'll be working with so many great legislatures, with the Children's Committee, with the Education Committee, and also with the Public Health Committee, to make sure that we have a chance to address the behavioral health issues here in the state of Connecticut, so that access to resources for behavioral health are made available through the school system and in the community, say through places like our federally qualified health centers like Generations or United Health Services.
Yeah, I just want to point out to folks that there's a way in which people in the legislature, senators and representatives, are chosen to serve on certain committees, and they can't serve on all of them. Okay, they serve on a few. And fortunately for us, we have a special need to have educational equity here in Windham in relation to other towns. And our state senator and our state representative are both members of the Education Committee. And Susan's been a member of the Education Committee since she came to the legislature, and actually Senator Flexer came to the legislature in the same time. She was a state rep for a while, but she's been a senator for quite a while, and she's another important part of the Education Committee and also the Appropriations Committee. They're both on the Appropriations Committee as well, another important committee.
Thank you for that, Dennis. And I have to say, because we are able to work together as a team, Senator Flexer and I actually worked very hard to make sure that we were able to get 95% reimbursement for the Renovate as New Windham High School project, but also for the administrative offices. And we just got that affirmed in legislation this year. So we got 95% reimbursement for the entire building process, whether it was for the school part or the administrative offices. And I have to say thank you to working with Senator Flexer, because we both worked very, very hard to make sure that that reimbursement came to our state, our local community here in Windham, rather, from the state. And because she's in the Senate and I'm in the House, we can do the two-step.
Well, I also want to give some credit to our local people on that great project. And I still remember when I was on the town council and I got a call from excuse me, Murphy Sewell, who was on the Board of Education, may have been the chairman at the time, told me they had to file an application for this renovation, and it had to be done quickly. So I said, I thought to myself, why are they asking us? And I said, oh, yes, that's right. The school buildings are owned by the town, not by the Board of Education. The Board of Education has the responsibility to use those buildings and those facilities on a day-to-day basis to educate our children. But the ownership of the building is vested in the town. So the town is, the group that makes policies for the town is the town council. So we had to sign off on that application too, and I was very proud to work with. Actually, the attorney for the Board of Education that I worked with on this was none other than Matthew Ritter, who is now the Speaker of the House of Representatives in Hartford, and he was very helpful to me in getting that application filed in timely fashion, and the rest is history. 95% reimbursement rate. Anytime you can get a building built and 95% of it is paid for by somebody else, that's a pretty good deal.
Well, it is a great deal, and it's great. I'm glad you mentioned Speaker Ritter, because Speaker Ritter has been great to work with. We have a really good team. I'm very thrilled, and I'm the Deputy Majority Leader, working with the Majority Leader Jason Rojas and Speaker Ritter, and we're all working very, very hard to make sure our towns are receiving more equity in the resources. And of course, you had a great deal to do with making sure that we started the process for the Wyndham High Renovate as New project. You were involved in that, getting that started for the council. But also, you've had a great deal to do with making sure that we have that work together as a group for the three-tiered system for the payment in lieu of taxes program, which has started us last cycle, 2 years ago, with an increase of $1 million a year for the pilot money. And that is something that we've really appreciated, and has really helped the town of Wyndham a lot, and all the other towns, by the way, that are serving towns and serve the regions with nonprofit organizations, serve the regions because we have a hospital here, serve the region because we have a university here. We have Quinebaug Valley Community College, which I'm thrilled if we just opened May 15th on Main Street. They're back, and that's another great thing that I've been working with Senator Flexer on. But these are things that actually help us. We have a Votex school here. We have an airport here. We have a lot of things that most communities, I don't think there's another community with 25,000 people that has all this stuff. But anyway, and it's one of the reasons that we have such a complex area. And we have 2 taxing districts and 4 fire departments and 3 police departments that cover 25,000 people. So it is very complicated.
Yeah, none of those great nonprofit facilities, such as the hospital, such as the university, they don't pay taxes. So in order to help us, ameliorate that situation locally, they have the pilot program, the payment in lieu of taxes program, but it doesn't pay 100%. And for a long time, it wasn't paying much more than 20%. And this thing that I worked on with all the mayors of the state, we with CCM a few years ago. I went
Connecticut Conference for Municipalities.
Connecticut Conference for Municipalities, and they got on board with a program to give the servicing towns, the towns that service their surrounding areas like we do, special consideration for pilot. They made a 3-tier program, and we're in tier 1, so we get the highest rate of pilot reimbursement now. Just recently this happened, and that is an example of our town working together with towns like New Britain, Hartford, Waterbury, Bridgeport, New London, and New Haven, and getting much more money in pilot reimbursement for our town. And they even get a lot more because they're much bigger towns. But you know what? They really need it just like we do. And I'm really proud of that as well.
You should be really proud. That was great work that you did traveling around the state, working with those other, municipal leaders. Fabulous work, and it reached the ear of Senate President Pro Tem Marty Looney, who proposed the legislation and got it right through in the beginning of session. So that has been a great thing that we have now in place in legislation. And so we will be the last ones to be hit up for a reduction if there is a crash in the economy, which is very, very good. And it's a great thing. And then before, it used to be just a straight shot across the board, a crash in the economy, everybody lost. Now it's going to be according to the tiered system. So
yeah, it's a great change for us, and one of the reasons why the town is doing so much better financially.
Yes,
because the increased pilot money, the increased ECS, the fact that our school project, which people were very much concerned about, because I think, as you pointed out before, Susan, when I heard you on the Wayne Norman show last week, the normal reimbursement was 78%.
Right.
And now we're getting 95%, and that's a savings of, $15 million.
Oh, no, it's almost $20 million. It's about, almost $20 million.
$20 million saved for local taxpayers.
Yeah.
Thanks primarily to Representative Johnson and Senator Flexer.
All right. Well, we're winding down. I can't thank you so much for your kind words, Dennis, my co-host. It's really good to be on the show with you to talk about some of the things that we were able to do this last legislative session. There's a lot more that we can talk about, and we will do that in some other time. But right now, we're going to have another great show next week, right, Dennis?
We will definitely be back with Matt Rupar and another great show next week, and I don't know whether it'll be you and me or just you, but one of us at least will be here, and I know Matt will be here too. Thanks,
Yes.
Matt.
Thanks, everybody, for listening. We really appreciate it, and we look forward to hearing you, seeing you, and we do have a podcast, so if you didn't get a chance to hear this, you can go on the WILI website, or you can go on my webpage at the Capitol, and you can also hear the podcast there.
I want to thank Denny and Craig Gates for sponsoring the show for 20 years at least, and giving us an opportunity to talk to the people of this town and this area. Thank you so much.